Connected by purpose, driven by passion. Welcome to the Spark Live webinar series, where we gather to curate, convene, and showcase excellence and innovation from across the child and youth healthcare community. Our goal is to spark conversation, ideas, and action. Children's Healthcare Canada would like to thank our funding partners for their ongoing contributions that support all of our programs and activities. Keep up to date on all of Children's Healthcare Canada's webinars, events, and announcements. Sign up for our Spark News e-bulletin by visiting our website at childhealthcan.ca and follow at childhealthcan on Instagram, X, and LinkedIn. Now, on to today's webinar.
Hello, everyone, and welcome to another edition of Children's Healthcare Canada's Spark Live webinar series, a service to our members, strategic partners, and the child health research community. I'm filling in for Paula Robeson today. I'll be your host for the next hour, and my name is Ryan Boyson. I'll begin by acknowledging that Children's Healthcare Canada operates on the traditional and unceded territory of the Algonquin Anishinaabe peoples. We recognize and deeply appreciate their historic connection to Ottawa. Today, Ottawa is home to Indigenous peoples from across Turtle Island. Children's Healthcare Canada is committed to working towards forging new and deepening existing relationships that include First Nations, Inuit, and Métis peoples, and is grateful for the opportunity to share this land as we work to measurably improve children's health outcomes from coast to coast to coast. We are delighted to speak with our colleagues from the Transition to Adulthood during COVID-19 network. I'd like to introduce you to our speakers for today. Dr. Karen Cook's interests focus on improving the experience of youth and young adults living with complex health conditions, especially their transition from pediatric to adult healthcare, to reduce barriers and support their personal goals. Karen is also actively involved in bringing grief out of the shadows and into the public square through community engagement and workshops through her work at gatheringgrief.com. Jessica Gabors is a patient advisor, co-investigator, and accessible documentation specialist at CanChild. Since graduating from the Toronto Metropolitan University School of Journalism in 2015, she is a writer, web developer, and accessibility specialist. As someone with moderate cerebral palsy, Jessica is passionate about accessibility and disability advocacy. She uses her work to promote awareness of living with disabilities and the need for accessibility throughout research, knowledge translation, knowledge sharing, and implementation processes. Daniela Grahovets is a parent of a 21-year-old young man with level 5 cerebral palsy who has recently transitioned from the pediatric to adult healthcare system. Daniela has extensive lived experience in the field of childhood disability and a passion for making a difference in the lives of these children and their families. Trained as an IT engineer, Daniela is working as a technical support specialist at CanChild. Daniela has actively participated in various research initiatives, contributing to the development of websites and knowledge dissemination activities as a parent researcher. She is also a board member of the nonprofit organization All Abilities All Stars, an organization providing sport and educational programs for children and youth with developmental conditions and their families. Dilshad Kassam Lalani is a mother to 3 beautiful daughters ages 27, 25, and 19. Her middle daughter has a complex, chronic, and life-threatening medical condition and disability. As a parent, Dilshad has lived experience of having navigated the healthcare system for over 2 decades to access necessary services to meet her daughter's healthcare needs. Dilshad and her family and her daughter experienced a successful transition from the pediatric to adult healthcare system. Her daughter received a transplant 2 years after being transferred from the so comfortable pediatric hospital to the adult healthcare system. Professionally, Dilshad is an experienced nurse practitioner who has worked in the hospital and healthcare industry across the continuum of care. She currently practices at Holland Bloorview Kids Rehabilitation Hospital in the Spina Bifida and Spinal Cord Injury Outpatient Clinic and has a cross appointment to Vibrant Healthcare Alliance and Johnson site in the Young Adult Spina Bifida Transition Program. In addition to providing comprehensive healthcare to adolescents with spina bifida and spinal cord injury, she provides leadership in the development and implementation of an evidence-based medical transition care model for young people transitioning from pediatric to adult healthcare systems. And finally, Dr. Jan Willem Gotter was the inaugural chair of the Children's Healthcare Canada Transition Hub from 2019 to 2021. He has a special interest in transitions from pediatric to adult healthcare. His research focuses on collaborating with partners who have lived and living experience to improve the health and well-being of youth and with disabilities and their families. In his clinical work, Dr. Gorter is committed to the family-centered model of care and life course approach. Welcome all, and it is now my pleasure to pass the mic over to Dr. Jan Willem.
Thank you so much, Ryan, for the introduction. It truly is a pleasure to be here today, and also I'm very proud to co-present with all the speakers today. We'll get back to them in a minute. As you can see on the first slide, our work, and we want to acknowledge that the work has been funded by the Canadian Institutes of Health Research. This was a project that was co-led by Dr. Anne Fournier at Sainte-Justine in Montreal, Dr. Karen Cook, who has just been introduced, and myself. And we were all in partnership with Paula Robertson from the Children's Healthcare Canada, along with a much larger team of patient and family partners, clinicians, researchers, and staff. Next slide, please. So you already heard our official affiliations and backgrounds a little bit, but I would like to ask our speakers for today and our panel just to bring out a little bit their own voice in terms of their commitment to the project and why they felt so strongly to participate and take a role in this project in the first place. So maybe Karen, can I ask you to say in a few sentences and talk about your passion?
Thanks, Jan Willem. Yes, a number of years ago, I was working with young adults with neuromuscular conditions who were transitioning from the pediatric to adult world, and in their care place that they were able to have respite. When they were leaving, there was a beautiful graduation ceremony for them, where their skills and abilities, whether they were great at math, they were great at they were kind of comedians. They were very skilled at doing different things. They were great wheelchair soccer players. A showcase of strengths was so evident to me. And at that time, there was a really big chasm between the pediatric and adult world. And I knew that there was a long way to fall. And their young adult years are a time of growth and potential. And so I felt very committed to being able to support them to continue growing on in their strengths.
Thank you so much, Karen. Let's continue with Jessica, you next on the screen and slide.
Well, as someone living with moderate level 3 cerebral palsy who had aged out of the PEDS system about 10 years ago, I know firsthand just how difficult that transition can be, and that it is very much a cliff that you fall off of, and that there's not a lot waiting for you on the other side. So I'm very passionate about helping to improve that and make it better for the next generation.
Thank you, Jessica. And I'm sure we'll hear more about your lived and living experience later in the presentation. Want to continue and invite Daniela to say a few words?
Well, hi, everyone. Oh, well, you heard that I do have a son who is actually from last week, 22. He had his big birthday. And at first I was stunned how that is difficult to transition. And I was, looking how to help our family, but also other families, because that's what I do for about 10 years now. Everything that, we learn something good, I'm trying to share and help others. So I think it's this work is really important, and there is a lot of things that we can improve because, we are in Canada. We should be better. Thank you, William.
Thank you, Daniela. And let's continue with Dilshad.
Thank you, Jan Willem. Thank you for having me. My interest really lies in bringing forward, through my experience, a parental voice. I think that during our transition from pediatric to adult care, I feel that during the preparation stage, I noticed that the parental role was rather underutilized and a missed opportunity. And I think it also had consequences not to have it well utilized. And also at the same time, I do feel that we had a positive transition overall. It wasn't perfect, but it was the best that it was going to get. And, when I look at my daughter now and she's thriving, and a lot really did have to do with that transition. But, I had a lot to do with that because of my professional background as well. And I really am passionate about every single adolescent that I care for in my workplace to be as successful as my daughter. And so I really want to put it out there as to what factors made it successful versus the barriers that we actually faced that didn't really have to be there.
Thank you so much, Dilshad. So maybe you can continue to the next slide, and I'll tell you a little bit about the what you can expect from us in our conversation today. We have 5 parts. First, we want to set the stage. So as a little bit of an inspiration for the Transition Research Project. Then we will listen to the power of the youth and the family voice throughout this project. And that will be a very interactive part. Then we go more to the results of our project, and then we really want to take it to the next level. So yes, there is new knowledge, but also what is the impact and how we learn from and about stories of youth and families, and how those personal stories can be used. And we want to highlight what we have learned, to end with a wrap up and really open it up for conversation and talk about next steps in this project. Because the knowledge needs to be used. We heard that from our partners with lived and living experience, that's what drives us. So now you know a little bit who we are. Next slide, please. I will prompt to start a poll about who is joining us for today's conversation. So that gives us a little sense in terms of backgrounds, who is on the call today.
Perfect. So we're just waiting for a couple people to answer the poll. And it seems like right now we're about 50-50 between health professionals and researchers who are joining us today.
Okay. So I guess the poll, oh, here are the results. So thank you so much for joining us. And we know that you are all probably come with the lived and living experience of youth and families with you. And we also hope that you will take it back to those who need it most. So next slide is really to set the stage. And we want to take it back to where this all started as an inspiration for the project and the research. As you have heard, in 2019, Children's Healthcare Canada was inviting calls to start health hubs, and we felt it was a good time to come together as a community of practice, and we called it the Transition Hub in Canada, or the Health Hub in Transition. There is a website that you see the front page here with a lot of resources. And mind you, it was launched in 2019 to build and to continue to build that community of practice. And when that just got launched, and only a year later, we were faced with COVID. And so we had to respond to that, because we heard the voices of youth, families, clinicians, researchers, and policymakers, what was happening out there in Canada, from coast to coast, in terms not only to everyone's health, but also to the health and well-being of the most vulnerable people with chronic health conditions, developmental disabilities, and so forth, and of course their families. Next slide, please. So as we know, transition and healthcare transition is much more than the transfer from pediatric to adult healthcare services. It's really a purposeful movement from childhood towards adulthood. I can talk for a full hour on this topic, but I really want to invite Daniela to share her story and the story of her son, Vasily, about the experience transitioning when COVID happened. So Daniela, are you ready to share what happened at that time?
Thank you, William. But I will definitely step a little bit back in time before that, because I have to say this. We were really lucky that Jan William was our doctor. I mean, Vasili's doctor, but I embrace all his doctors as ours. And he did create at that time, it was like when Vasily was 14, 15, I believe, a transition clinic in Hamilton. And that was, I mean, his visions are really like unbelievable. And thank you for that, Jan William. So we were trying to get ready there for transition, and that helped a lot, really, what to do, what kind of paperwork, whatever, we needed to do, it was provided there. But then the COVID happened. And right there when he was about to transition, and that was like, with all my resources, everything that we knew, we really felt like we fell from the cliff. So I believe that at that time, when something like that happened, all good also, and bad things will somehow surface, and then we will get in a survival mode, and something good can come out of that, right? Because we get creative, and it did, but it was really hard because things were delayed, and well, you all know how that was, but for us it was really hard. We were struggling for a couple of years to get back on track. One thing that I know that helped a lot, and I will just say it here, was because it was Jan William. He actually, when he did that transition, document to the other doctor that will cover for him, he did it so well that doctor actually embraced us, and we just continue as he knew us forever. So that was a good thing, really good thing that everyone should do, following that example. So thank you, Jan William.
Well, my pleasure, of course, Daniela. And I can't believe how hard it was, because here you go, right, with all the preparation in place, that healthcare transition is much more, right, than we can basically control in our clinic. And as you said, there were many, many stories, right? This is one story, your story is one story, but there were way more stories in the Transition Hub, and we were talking about it. And we came together really around the purpose of the research to better understand the positive, but also the negative impacts of the pandemic. We want to learn from in both ways. So young adults, parents, and researchers partnered on the research to learn about the impact of the pandemic. And we defined it on youth with special healthcare needs in the age range between 16 and age 24. So basically during the transition to adult healthcare services. And special healthcare needs, we defined it broadly, so that may include developmental, physical, or mental health conditions. Next slide. So this is what we did. We had 3 steps in the project. The first were the interviews. So we wanted to have a better and deeper understanding of those effects of the pandemic. And so you can read on the slide that we were able to do interviews in both English and French with 21 Canadian youth and parents in 4 provinces. And then youth and parents shared the lessons from their own experiences of healthcare transition during that time frame. And rapid analysis and review of literature were also very helpful to inform creating the survey. So with that new knowledge from the interviews, we moved to a step, we scaled it up to a survey. And that survey, again, in English and French language, was sort of broadly to a whole data set of we want to reach as many young people and parents. And we were able to reach 516 Canadian youth and parents in 10 provinces and 1 territory. And that enabled us to gather information more broadly about in a sense, the validation of the results of the survey, but also recommendations and priorities to improve healthcare transition. Again, we used all that information, and then a rapid analysis was done to inform a virtual town hall meeting. And that was actually step 3. That was the virtual town hall meeting. A bilingual virtual town hall meeting was held with 55 attendees and a range of backgrounds, including youth and parents, health professionals, researchers, and educators from 8 provinces. And the whole goal was really to come to a strategic priority setting and development of recommendations. And we'll come back to that in a second. I will move the mic to Karen, who will start the conversation around the results. Karen?
Thank you, Jan Willem. So our next step in the research process was to determine how to leverage our findings and the interviews and town halls into specific priorities to improve healthcare transitions. And our recommendations to improve healthcare transitions fall within 4 domains, which are, number 1, that there'll be a gradual transition preparation. Number 2, that there'll be coordinated and continuous care within and across systems. Number 3, that care would be collaborative and patient-centered. And number 4, that there's flexibility in the delivery and transfer of care between the pediatric and adult systems. To offer some insight into some specific examples within each of these domains, our partners in research, Dilshad, Daniela, and Jessica, will give their personal examples of why it's important to implement these recommendations. Next slide, please. This slide represents the first of the 4 domains, that there'll be a gradual preparation for transition, meaning that transition preparation should start several years prior to the actual transition, which usually happens around 18 to 19 years of age. And in the next 4 slides, you will see these 3 columns, the blue, the orange, and red, that provide the key points that came out of the research. The blue column will always speak to the experiences of the youth and parents, youth with special healthcare needs and their parents. So in this domain, for example, they said sometimes during transition preparation, parents are included or excluded without asking the youth with special healthcare needs. The orange column describes what we learned during the transition process. And Jessica, I'm wondering if you can tell us here about an example about how healthcare providers should talk with families about their preferences related to their changing role, the changing role of their parents and the caregivers as you prepare to transition.
Definitely. Thank you, Karen. So I was very lucky with my family and also my general practitioner while I was growing up that um, I grew up in a small town and there were some challenges with that, but the upside was that we knew our general practitioner very well. He knew my entire family. We could speak to him very openly. And my parents, especially my mother, reminds me a lot of Daniela actually, uh, was a very, very fierce advocate for me. And she wanted me to learn how to be involved and learn how to advocate for myself, how to speak to doctors about my own needs and care. So my doctor and my parents and me had a conversation about how they wanted me to be more actively involved in probably from the age of like 15 up, be more actively involved in my own appointments and speaking about my own care, to the point where when I was like 16, 17, I was going to doctor's appointments on my own. A member of my family, usually my grandpa, would drive me to my appointments, and I would go and speak to my doctor about my concerns or my needs at that time. But the night before, usually my mother and I would have a conversation about what that appointment was going to be about and key points that needed to be addressed, either things that I had mentioned to her before, but maybe had forgotten about because I was a bit nervous, or maybe things I didn't quite notice the same way that she did, concerns that she had. And we would make notes, often in my cell phone or on a piece of paper. She would write it down for me, and I would make sure that I hit those points with the doctor. And then the doctor would also make notes. Um, as we were talking, just because he could write quicker than I can, and give those back to me, and I could share them with my mom and my dad. And I know on a few occasions they probably had a phone call, but I was always, loosely aware of it. It never really bothered me because I felt included. But that was the system that my family had sort of put in place for me to, sort of take more control and learn how to advocate for myself. Because once I got older, I was going to need to do it myself, especially because I intended to move away for college and university. So that's how we handled that. But I really appreciated that they had that conversation. I think it's important to ask youth and their families, but mainly the youth, what they want and what they want their families' roles to be. It could be a bit different for everybody. But I definitely think it's important to have those conversations and give the youth the opportunity to have, make some of their own choices and have some say in their care. And it also helps prepare them for down the road when they may need to, handle it more independently because they may not have as much of a choice.
Thanks, Jessica. Jessica, those are excellent specific examples to think about from your own experience. And I'm going to ask you again from the red column about how we can improve. What would you suggest to do around creating diverse networks of support for mentorship, coping, and comfort in terms of being successful with your transition?
Well, I grew up going to a rehab center near my home. So there was sort of like a class of kids with similar disabilities, to similar CP and disabilities to myself. And so we all kind of transitioned around the same time. So through that rehab center, there was a lot of network support, mentorship, coping, and like peers. And I know that the parents also relied on each other, but we all made different choices and started to transition to different areas for, post-secondary or not. So I think it's important to provide those opportunities similar to my rehab center did, but also keep in mind that if the doctor, that the pediatric system, the doctors and the healthcare providers that we're dealing with often know more people than they realize where you might be transitioning to. So it would have been helpful if my pediatric healthcare team had been more open and willing to, maybe make a recommendation in Toronto. Because now that I work with CanChild, I realize that everyone sort of knows each other if they just think about it for a few minutes. At least somebody knows somebody who might know somebody, right? So helping, like talking to the youth about their next steps and where they think they might land, and maybe helping to make connections to, healthcare and services where they might land, would be helpful. I not only transitioned from peds to adult, but I also moved. I moved to Ottawa and then I moved to Toronto. And I was, very politely told that that was sort of out of their purview and they didn't necessarily know who to recommend me to, which now in my professional life, I realize may not that it was nefarious, but may not have necessarily been true if they just thought about it a little bit more. So that is something that I recommend is talking to the youth and their families about what kinds of services and where they might land, and seeing if we can make some sort of like recommendation and connection.
Great reminders. Thanks so much, Jessica. Next slide, please. So our second domain encompasses the importance of coordinated and continuous care from childhood through to adulthood. In the blue column, one of the examples we learned was that the youth were unable to access equivalent services in adult care that would help to maintain and enhance their well-being. Daniela, in terms of what we learned, can you tell us what you learned and obviously what you already knew about why youth with complex conditions and families urgently need better access to consistent and specialized care across the lifespan?
Well, thank you, Karen. Yes, of course. Well, by now you probably heard that, yeah, Vasily has a complex needs. He has a cerebral palsy level 5, and he depends on us completely, which makes, the life more harder to navigate. And I have to be his voice and everything else to do for him. So basically, by the time what happened with COVID, we also lost our family doctor. She went retired. So that was another burden on us. And going to the specialist, getting actually there, get that referral that's supposed to happen automatically, but we waited for urologist for 3 years to actually get to him. I was lucky. In the meantime, we would travel back home, so I was checking this Vasilia there, but still that should not happen, right? And then, what I noticed when we start to going to new doctors that, they're not trained that much to work with children like Vasilia. And that he, for example, he was looking into me to give him all answers, but Vasily is also able, even I explained, to give you an answer. He can answer yes and no questions, but it takes some time, so they need to give him some time. And usually that's the appointments in adults world is like quick, just do, and we're done type of thing. But that's not how it's supposed to be, right? You can't do it that way. I was trying to allow him to make his own decisions, which did happen before in a when he was a child. So when I was thinking how we can do this, there is two things that can be done, or either thoughtful transition, similar what I told you about what young William did, or just stay with the same team. That would solve a lot of problems. Thank you.
Those are poignant points, Daniela, about how efficiency overrides compassion too often. Jessica, in thinking about how we can improve, what are your suggestions for healthcare providers around providing holistic physical and mental health surveillance and support across your lifespan?
Well, as mentioned earlier, and Daniela has alluded to as well, is the transition from peds to adult healthcare services, whether it be, the traditional healthcare, like medical or physical therapy and like mental health. Once some of those things are available to you, like there's a bit of a system when you're a kid, and then when you transition out, it just sort of falls off. It kind of gives the impression that they're like, okay, you're no longer disabled, you no longer have mental health struggles, you no longer have regular people health issues in conjunction with your disability. Good luck. So to be more mindful of the fact that yes, the system, you need to transition, but that the lifespan, in fact, that it is in fact a lifespan and that it continues, right? One thing for me, like I mentioned earlier, would be, helping with that transition, making suggestions and connections between the systems if possible. Like maybe my physical therapist from, my rehab center that I transitioned from knows a physical therapist in Toronto, or at least knows where to look for one that they can maybe recommend, because that is an example of something that took me a very long time to find as an adult. It took several years and lots of trial and error to find a physical therapist that understood cerebral palsy, let alone cerebral palsy in adults. Like I literally saw them Google it in front of me on a couple of occasions, and reiterating kindly that it's not a sports injury and it's going to sort of last forever. Also, mental health services is a big thing to keep in mind too. I had supports in my childhood rehab center and through school, but then when you graduate, it kind of disappears or becomes very expensive. But we know that 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 children, youth, and adults with disabilities are predisposed to mental health struggles because we're dealing with all of our healthcare challenges in a world that's not made for us, in conjunction to all of our, regular people struggles, right? So it's just being mindful of that and creating opportunities to keep that going. If you know what I mean, right? It's just right now it kind of just drops off. Like you no longer need those things when you turn 21, and that's not the case. Often you need it more because you're going into more adult responsibilities, which can be very overwhelming for any youth, let alone someone with a complex health condition.
Jessica, I really hear you saying how tiring it is to continuously retell your story, and you're hoping, because you're feeling vulnerable or need help, you're going somewhere where you're hoping for help, and you're finding yourself being a bit of an educator and often doing that repeatedly, and how tiring that is for you. Thanks for that. And Dilshad, what are your experiences related to the importance of continuous primary care for your daughter before and after her transition?
Well, before the transition, we did have a primary care provider in pediatrics who knew Afsana really well right from the time she came home from after me giving her giving birth. And so, our pediatrician was able to put the picture together for her, advocate, and know the services that she required. However, when we transitioned over, She was actually not well at all, and she was decompensating, and her condition was progressing, and it was life-threatening. And it is not a time that you do not have a primary care provider. And she waited over a year to actually have a primary care provider, which then ended up with a lot of ER visits. We were in the emergency department, I would say, once every 10 days or so. And some of that didn't really need to happen if we had a primary care provider. And more importantly, she needed somebody in the healthcare field to advocate for her, but needed to know her from a holistic standpoint. And only a primary care provider can do that and coordinate that kind of care for her, or advocate for the things that she needed. For example, she would go into the ER because she was in incredible amount of pain, and rightfully so. But we worried so much, and she worried specifically about being considered drug seeking. And she wasn't. So then she would hesitate to actually even tell me that she wasn't well, and so that she didn't have to go to the emergency department, because she didn't want them to think that she was drug seeking. Because when she really, really, truly needed it, she wanted them to take, when I say them, the ER staff, she wanted them to, to take her seriously. So that was a really big issue for her. And also, very serious was a time where she was ready to be put on a transplant list, but that was delayed because the left hand basically didn't know what the right hand was doing, or that didn't have that understanding, whereas a primary care provider would have known her holistically and could have said, it doesn't matter that her weight is not good enough for a transplant, but she's not frail. She's always been small from the day she was born. So let's not delay the transplant because of that, because she's not frail, she's still strong enough. Whereas the adult care system, individual specialty care folks felt that, oh no, she's too small, we can't take a risk, because if you're going to have a transplant, you should be a BMI of at least 19 plus. She was nowhere near that, but she never has been all of her life, right? And yet, before she was decompensating, she was thriving. So a primary care provider could have given that picture for the specialty care. And as a parent, when I try to do that, it's not always taken as seriously as it could have from a primary care provider.
Thanks, Dilshad. We're also aware of our weakness in Canada around providing primary care, but for youth with complex healthcare conditions, boy, it magnifies exponentially what happens without that kind of support. Thanks so much for that. And on to the next slide, please. So the third domain and focus that we arrived at was the importance of collaborative and patient-centered care. And for example, the youth and parents told us during the pandemic that they experienced reduced connections with their healthcare providers, and were feeling less heard by their healthcare providers as well. And thinking about what we learned, Daniela, can you tell us about what you learned about the importance of patient-centered care so that youth receive specific care approaches that are tailored to their unique needs rather than generic parameters like diagnosis or age?
Certainly. Thank you, Karen. Well, our experience with patient-centered care is not that patient-centered care. I can tell that adult system doesn't know much about it. So yeah, I'm still trying and doing it to educate them, but I was lucky to learn about F words, which sounds funny for people who doesn't know them, and that's family, friends, fitness, future, functioning, and fun. So yeah, and if you want to learn more about that, there is a Efforts Knowledge Hub on a Can Child website, where actually that concept helped me to paint that whole picture more quickly for new service providers, so for new specialists. That really and I was persistent, and I'm still is. I don't go below that. They need to see the whole picture, because we have our own needs, we have our own goals, we want the specific care for us. So it's like just that's like a bare minimum for us. So basically, yeah, I think that they need to be more educated, really, about the patient-centered care and all of that, even to learn about F words. And yeah, that would help a lot to see us as people with all our environments, that like what we are coming with.
Thank you for sharing F words that have a kind edge to them. I appreciate that a lot. That's awesome. And Dilshad, what would your recommendations for improvements that are needed in government policies that prioritize the youth's human rights, especially when their health is deteriorating?
Well, we've known for a very long time that poorly planned transitions or the lack of specialty care that's appropriate for young adults who are transitioning to adult care system can lead to more increased morbidity and mortality. We know that. We've known it for a long time. But I think that, we haven't done enough in the adult care system to accommodate for this. And I have personal experience with my daughter deteriorating because of the fact that we didn't have the right specialty care for her, to the point where she was delayed over 3 months to have a transplant, just because there was a very simple intervention not available in the adult care system. And the answer was, we just don't do that. It's just not good enough. Whereas in pediatrics, it's as simple as increasing your fluids. It's so simple, but it's not something that the adult care system did. There wasn't a structure or system in place for it. They didn't know where to document it, that sort of thing. And so I really feel that transition, it should be considered a determinant of health, really. And with that, policies that prioritize specialty care needs in the adult care system. And if that's not available, then I think that we need to advocate government policies that our system needs to be integrated, and it needs to be collaborative between pediatric and adult care system. And it shouldn't be two different systems. It should just be a continuum, really. And if one system doesn't know or doesn't have the expertise in doing with a certain intervention, then you can easily reach out to your pediatric collaborators. Simple. Right. And so I think that the most important thing that we can ask the government to prioritize is to ensure an integrated and a collaborative system, so that care needs for young adults who are transitioning are met, and they have the human rights for it, because they want to be able to do well. They want to be able to live. It's a life and death sort of thing. And we almost lost my daughter, actually. She was delayed over 3 months, and then was crossing over to become palliative. And those 3 months would have been really, really important in searching for a donor. But she was put on hold just because, she didn't have enough weight, and yet they could not help her to gain that weight. But if she were in pediatric, every single young adult who needs a transplant that had their, very, very low weight was on an NG tube, but it's not something that they did. And to me, that was just almost ridiculous, just because it was such a simple intervention. And we ended up having to go outside of the system and ended up going back to pediatrics. And colleagues of mine who were personal friends ended up helping out, which is not safe, actually, because you do need an X-ray once you put in an NG tube. But we were doing it blindly sometimes, and so that wasn't appropriate. But we didn't have a choice, and so I just think that our young adults need priorities that will keep them safe when they're crossing over, and not predispose them to increased morbidity and mortality.
Thank you, Dilshed. Your examples, speak so much of the gravitas and the problems that arise and the helplessness that you feel as parents or as youth in these uncertain circumstances. Thank you for that. Can we move on to the next slide, please? Thank you. Just in the interest of time, we're going to have everybody have a chance to give their examples here, but can see that the clock is running down on us. So I'm just going to quickly run through these with you. So the fourth domain, the priority was around the flexibility, necessity for flexibility in the delivery and transfer of care. In column 1, the youth told us that the pandemic led to services being offered in new and different ways. So there was some positive outcomes on that. And in terms of what we learned, we heard examples, what we learned, we heard examples of how flexibility was possible to extend in pediatric care. And in terms of how we can improve, that there was a suggestion that virtual options continue, and that they're also expanded to enhance the communication amongst the pediatric and adult providers. I'm sorry to cut us short on examples in this slide, but we're just really down to our last few minutes. So I just want to say thank you to Daniela, Dilshad, and Jessica for your helpful examples that really illustrate the importance of our recommendations. And it is your voices that really bring the importance of that to life for us. So I'm going to turn it back to Jan Willem, who's going to summarize some of our ideas and help us move forward to actually making changes in each of our priority domains.
Thank you so much, Karen, and thank you so much to all of you for the presentations. I just want to wrap up, also given the time, and what we really, as a project team, but also a wider Transition Hub community of practice, want to share with you and want to invite you to be part of us about ideas to help us move forward with our thinking and also making a difference in these priority areas. So this came, as you heard, all together through a patient-oriented design, right? Voices of youth and people with lived and living experience were heard, as well as healthcare providers, and it was truly a pan-Canadian study. So we feel strongly about the evidence and the information that is in this project. We also feel that the priorities and recommendations and strategies can be used to inform professional practice, policy, guideline development, and program changes. And here you can read a few on the slide, including to map the people and organizations in both child and adult healthcare systems to identify those who are already working together and where connections need to be made. Find and connect with people who are already doing some of this work and who are in a position or of influence to support this work. And balance working on long-term changes. So not only the immediate changes, but also long-term changes. We heard about system-level changes, finding funding, continuing or building on effective approaches. Next slide. is to explore how at the provincial and territorial level the governments can handle transition, identify effective or promising practices, consider how these can be applied in other areas, finding the leaders and decision makers who support this work and can act on changes. And lastly, continue to meaningfully engage diverse groups, youth, parents, pediatric and adult healthcare providers, in particular adult healthcare providers, I can't say that enough, to better understand healthcare transition experiences and opportunities for improvement. So we come to the end of our presentation. We really want to open it up for questions and discussions. We want to check the question and Q&A chat for that. In summary, the study aimed to learn from positive and negative healthcare experiences during the COVID-19 pandemic. In a way, it accentuated and accelerated the issues, basically, that families are facing and young people are facing. So many of the issues we talked about might be familiar to you. But the real thing is, how can we use this information and can learn, and that something good come out of that horrible period of COVID times where youth and families were and felt alone in that process, both at the local as well as the regional and national level. So we hope to continue the conversation with the Canadian Transition Hub to determine next steps, both the more immediate and maybe low-hanging fruit steps, as well as more high-level long-term changes to make a difference in the lives of people with special healthcare needs and their families. Thank you so much, and I'll turn it over to, I guess, Ryan or somebody else.
Thanks, Jan Willem. And thank you for sharing this important thought-provoking evidence and providing that link to the valuable resource. I see our audience does have a question too, and I'll take a moment to read those. For those who have not shared questions, now's the opportunity. And while I'm doing that, I'm just going to ask just a few quick poll questions to help us continue to improve our Spark program. And again, you will have to select an answer to all the questions before hitting submit. So while our participants are doing that, I'll pose this first question. Kat Goodfellow put it in the Q&A. We know that there are additional healthcare barriers for newcomer families. Was this a theme that emerged in your research? Were there any specific or additional factors that affected newcomers, and what improvements could be made for that population?
Yeah, that's an excellent question. Daniela, do you want to speak to that, or Dilshad?
Yeah, well, thank you, Jan Willem. Considering our research about that, I believe that we didn't ask who is a newcomer or not, but anyway, imagine that's a newcomer. I was a newcomer to a new system, new doctor, right? But imagine plus on that language barriers and not knowing the system. I mean, these people are definitely in the worst position for that, right? Like all these things that we learned from COVID, it's just I mean, they were there, they just surfaced, in a way that we can see them really good because that happened, but they're still there. We need to address them, and yeah, a group of people definitely needs even more attention to this.
Thank you. And the other question was just looking at some of the findings. Some of these things we knew before, but what would you say are the specific lessons learned as a result of the pandemic?
Yeah, I'm not sure how much time we have, but I think I would agree that many of the issues that resonated with some of the knowledge we already had, but that really brought out more explicitly the issues. And also, I think there were some good examples of in the pandemic that the system was challenged in so many ways. So people had to come up with creative solutions. And I hope we can take that with us moving forward. For example, the virtual care visits. That was really appreciated by the youth, as it was also more addressing and closing, talking about patient-centered approach, the real life issues of the families, rather than young people and the families visiting a hospital setting where there is a very specific setting and also an expectation to talk more about medical issues rather than maybe other issues that are going on in the lives of the people. So that might be one thing. And we also heard from Danielle in terms of the flexibility, in terms of age range, that yes, there are guidelines and there are also regulations around the age 18, but that in a way was created. We have created our own systems, so both the pediatric and the adult healthcare system, and now we are dealing with it. And COVID did show that there was more flexibility possible. So let's keep that moving forward.
Thank you for sharing. I think that is the end of our time together today. So thank you to our speakers for sharing your time and expertise with us. And thank you to our audience for joining in. We know how busy you are right now. We hope you depart with some practical knowledge to bring back to your organization. I'll just close out today by sharing a few other ways to engage. First, our most recent Spark Conversation podcast invited Tatum Wilson alongside our host, Dr. Catherine Smart, to discuss collective action and advocacy, coalitions, and right-sizing children's healthcare. Tune in on your preferred podcast platform to give a listen. And then please also save the date for our annual conference 2025 taking place in Ottawa at the Westin, April 14th and 15th, just 4 months away. Sorry, Paula and Sarah, if that was scary to hear. It's always great if you can watch live, as your questions and comments really enrich the discussion. But if you can't, the recordings of these sessions are made available after the fact on our website. And thanks again for joining us today. Thanks to our wonderful speakers for this presentation. And hopefully we'll be seeing many of you back here soon. Thanks, everyone. Have a good day. Bye.